Hello, I wanted to discuss dry eye syndrome in simple terms. Dry eye is one of the most common problems affecting the general population. We have a natural layer of tears that coats the front of the eye called the tear film. Normally, this layer of tears is stable and it provides protection to the front of the eye as well as helping with the focusing power of the eye. When the tear film becomes unhealthy, it breaks down in different places, leading not only to symptoms of irritation, but also causing unstable and intermittently changing vision. People with dry eyes can have symptoms of burning, stinging, itching, tearing, sandy or gritty feeling in the eye, frequent blinking, caking of the eyelashes, which is usually worse upon waking, redness of the eyes, blurry or fluctuating vision, which is often made worse when reading or using screens. One can experience light sensitivity, eye pain or headache, feeling of heavy eyelids, and eye fatigue. Patients often wonder why their eye can be dry despite producing plenty of tears. This is because the unhealthy tear film and the irritation that comes from it stimulates the brain to produce reflex tearing to help counteract the irritation. There are many things which can contribute to dry eyes. These include, but are not limited to, allergies, decreased hormones associated with aging, thyroid disease, eyelid inflammation, also known as blepharitis, various medications, including but not limited to psychiatric medicines like antidepressants, antihistamines, beta blockers, sleeping pills, diuretics, Sjogren's syndrome, where you can have dry mucous membranes throughout the body, can also cause dry eyes. Other autoimmune disorders like lupus or rheumatoid arthritis, skin conditions like rosacea, chemical exposures or injuries to the eyes, any previous eye surgery, including after refractive surgery like LASIK or PRK, infrequent blinking, especially associated with staring at screens, various neurological conditions, including strokes, Bell's palsy, or Parkinson's disease, being in a dusty, windy, or hot and dry environment, contact lens use, diabetes, and infections like herpes simplex or herpes zoster keratitis. There is no cure for dry eye. It is a chronic condition like arthritis. However, there are several treatments available to help manage the symptoms. Treatment for dry eye is like a ladder. We generally start with basic things and add additional things over time until the patient is comfortable. We often start off with conservative treatment like warm compresses and cleaning of the eyelashes. A hot towel, as hot as can be tolerated, can be kept over the closed eyes for about 5 minutes twice a day. Once the towel is cool, the eyelashes can be gently cleaned. Some people could also prefer to use heating masks. Along with this, artificial tears, preferably ones without a redness reliever component in them, can be used. If the artificial tears are being used more than 4 times a day, we often recommend switching to preservative-free tears. Longer-acting agents, such as artificial tear gels and ointments, can also be used, especially at bedtime. Modifying your environment, including use of humidifiers in a dry environment, can be helpful. Topical ophthalmic steroids, which are a prescription drop, are helpful in controlling the inflammatory aspect of the disease. There are tear-conserving interventions, such as punctal plugs or punctal cautery, which are very effective. Punctal plugs are small devices that are placed in the tiny openings in your eyelids that drain tears. They help to block the tears from draining and help keep the eye surface more comfortable. The same can be achieved with punctal cautery, where the puncta are closed more permanently using thermocautery. There are several prescription medicines, such as cyclosporin, which can help increase tear production, or a medication called Xiidra, which can help reduce inflammation. Autologous serum tears, which are made from a patient's own blood, can also be helpful. There are nuances to dry eye treatment, including the subtypes of dry eye and their specific management, which are beyond the scope of this video. You can speak with your eye doctor to help come up with a plan that is tailored for you. Please leave your tips, questions, and comments below. And as always, thanks for watching.